So, and remind me when we start the video.
Okay.
I'll take my glasses off so
no one sees you. So no one sees you.
I want no one to know I'm wearing glasses.
Ooh. You better take your glasses off.
I'll take this up after the show. Oh, hi everyone.
Hi GenderBlenders. Welcome to week 150. This week is a free topic week.
Well, that means that you're not going to charge me anything to make this video?
No, but we can't use our Coke advertisement either. So. So anyway, this week we thought we would cover a whole bunch of interesting things from pre-op preparation through post-op care after GCS. She has a whole bunch of videos on her site about the surgery and things like that.
Yes,
so we're not going to cover the surgery in this video.
No.
But we will cover post-op care after GCS.
Yes. When you go in to have surgery, even corrective surgery, even for an intense transsexual like myself, they have to first create the vaginal cavity if you don't, for a transsexual, because you don't have one. And that's called the neo-vagina.
When you're going through the healing, you know, you got a whole bunch of skin and stuff down there that needs to be kept clean.
It's in, after you're done and you're dilating and so on and so forth, you have to obviously clean yourself.
Clean, yeah. Clean.
With the Betadine, keep yourself clean and so on and so forth. Normally your surgeons and stuff like that will set you up with the proper tools and equipment and stuff like that, including what's called a little dish ball and stuff like that you use for flushing yourself out. Normally it's just the normal size is about a number 5 ball that they use for flushing yourself. Your dilators themselves, I always myself as a religion clean twice. I clean with
alcohol.
I clean with alcohol. I start off with alcohol for sanitation and cleaning. I use the hydrogen peroxide to clean it so like that before putting it in the bag, because then that kills off all the germs and gets all the alcohol and stuff off of it. Because you don't want alcohol stuck on your dilator. So I would suggest that you use that. Now, what is it that you actually started using about 30 days?
Yeah, about a month or so after your surgery and things like that. There's actually a vaginal cream, a Premarin cream.
There's a lot of doctors will tell you that you should use.
Yeah, and it looks sort of like this. Premarin cream.
Okay. Comes in a box.
Comes in a little box.
It has a syringe and all that stuff that you use, or that you use for injecting it into your neo-vagina. And you should actually use that for approximately how long?
6 months.
6 months was the norm. Some doctors will tell you they don't want you to use it at all. But I think that using it and that helps to speed along the process of your vagina turning into a natural vagina. Purpose of
that is to keep your vagina soft and things like that. And I think you're right. I think it does aid in converting it into the full vagina.
I'm kind of sure that it does. So those are some of the things and stuff like that for you to take into account. Now, I will say another thing that you just do not use. One of the things that they tell you to start using. And for a while you're going to have to. And there's obviously using pads and stuff like that, which you want to use the nappy pads and so on and so forth. So you want to make sure that you get stocked and stuff like that on those. And also what's called a bed sheet, because you want to keep your sheets and stuff clean. So you should get the medical bed sheets and stuff. But okay, and also, but one of the things you don't do is that you don't use tampons.
Don't
at all, because your body is in your fluids, your mucus fluids and stuff like that, lubrication that is obviously being created, by your new neo-vagina is not lubrication enough. As far as discharge is concerned, that is, some of the other uses. Now, one of the other things, post-op, as you start off with a small dilator, normally, I think it's normally about 3 centimeters and or 26 millimeters.
Yeah, 26
in diameter.
millimeters. Yeah.
And then you go from the 26 up to, I think it's a 29 or 30, and then from a 30 to a 34. But in any case, one of the questions some people have always talked about, and this is something I'm rewriting and I'm going to be submitting for republication and stuff of it, is as you're increasing in sizes. And I hear this. In fact, I heard you talk about this, but you hadn't thought about this. Is when you are increasing in your size,
and you're moving from one to the next.
You're supposed to do from each 30 days and 30-day intervals. When you're going to go from your number one size up to your number two size, start off using the number one.
Okay.
Right, just so that you're not starting from scratch.
Right.
And then after about 10 minutes, put your number two in, and you'll find it goes in a lot easier.
You have to take the number one out first.
Oh, okay. And then when you're going to go from your number two to number three, after the next 30 days, you're going to do the same thing and go from you start off with the number two. And you're going to do this for about a week, starting off at number two that day that you're supposed to be continuing over to number three, about 10 minutes, and with the number two size, and then go into the number three size. This is for proper expansion. You'll find it goes in a lot easier, and you don't have trouble with the expansion.
Some girls
do that for about a week, and then you can just straight up use.
Yeah, if you don't do that, some girls report when you go from one size to the next, it is really difficult.
Yes.
Much more so than you might think.
Yes.
Now, you might be lucky and not have that trouble, or you might find it indeed that's true, but...
Yeah. Well, you do have the vulva, which is about 4 inches into your vagina cavity, which is even that in a natural girl. And that ring, which is muscle tissue that has to be expanded, is very, very tender. Remember that that is kind of like directly hooked up to your prostate, which is what gives you that. Yeah,
so it gives you that nice feeling. But both Stephanie and I had our surgeries done at the PAI, Preacher Aesthetic Institute, and absolutely marvelous results. So we're kind of up on these folks. They do really good work.
Right, and also remember that after you've had your surgery and so forth, you have your new urethra and stuff like that. It's covered with a urethra flap, identical to that of a female.
It's absolutely perfect.
Then you are a lot more subjected to what's called infection.
Yeah.
Yeast infections.
And stuff. So you have to watch out for these.
So yeast infections and stuff. So you need to make sure that you are cleaning yourself regularly, and that you use the proper conditions and so forth, that you're really taking care of yourself, including washing your hands. Myself, I like using at least one surgical glove that I use to control and create. Because your hands, even though you may wash them, 10 minutes later your hands have the natural body oils and stuff like that still on them.
So so watch out for that.
It's always excreting. So that's why I kind of use the surgical glove. So. This has been some of the different things and stuff like that. We have a lot of different things that we could cover. We're going to cover those in individual videos, individualized, where we're actually covering, the proper cleaning methods, the proper cleaning methods. So that basically is some of the vital information and stuff like that Stephanie and I wanted to share with you. And of course, we'll get more into this possibly later on when we have more time. To shoot our videos and stuff for both GenderBlenders as well as our own videos, personal videos that we do. So until then, my name is Stephanie.
I'm Stephanie.
Goodbye, everyone.
Bye, everyone.